It's really important to have conversations and panels like this because the general public gets educated on what is actually happening. Our panel had a physician who is in the practice, so we're talking about diagnosing and studying the long-term impacts of COVID-19, which is critical to understanding it from a medical perspective, and then also having someone who is living with long COVID themselves.
I think that long COVID, long haulers don't have a voice. I think often you'll find that for instance, cancer patients, no one questions if you have cancer. You can get diagnosed for it. You can see if you have a tumor, you can see if your white blood cell counts are high, there are biomarkers. The importance of delivering a speech like this is to give people who are at home unable to leave a voice. I'm blessed with the fact that I've recovered somewhat, so I'm here just to be able to spread the word and what I know to be true in my experience, and hopefully they can kind of relate.
I am always honored truly when I get an opportunity to have a person's ear because it's not owed to any of us. A platform and stage is not owed, so it's an honor first and foremost. But then I also enjoy because I get to bring my experience from working with people day to day in the mental health space to a much broader audience, and seeing how people are responding to information, particularly around mental health. It warms my heart because I really believe that people will take those tips and go forth with them. I saw a lot of people, writing, and so I think for me, it makes it feel worth it to do the work.
I'm just happy to see there's a larger community than I expected that are invested in the wealth and health, well-being of people with this issue and people just suffering from the impacts of COVID.